Hello, my name is Michael Rich, and my celebrity PowerPoint presentation is going to be on Jeremy Reiner. Jeremy Reiner is a 53-year-old white male. He is presenting today to the clinic for a rash that he has on his abdomen. The rash has been there for 1 week. The rash is itchy, but with no pain. The itchiness is constant. Nothing seems to make it better, nothing seems to make it worse, and the patient rates the itchiness for his rash 4 out of 10. So Jeremy Renner is a 53-year-old white male that presents to the clinic for a rash on his abdomen. Rash has been there 1 week, constantly itchy. It's causing no pain, nothing makes it better or worse. Patient rates the itchiness 4 out of 10. The rash is a singular annular lesion with scaly border, slightly raised margin with hypopigmented center area. The patient has no medical or surgical history. The patient is up to date on his childhood immunizations and had 2 COVID-19 immunizations, and he gets his yearly flu shot. Jeremy has no known allergies to any medications or anything else. Jeremy takes no medications or additional supplements. Jeremy denies smoking, denies alcohol use, denies the use of drugs, including marijuana. He is married and currently employed as an actor and is financially stable and lives at home with his wife. The patient is sexually active and not using contraceptives. The patient is a heterosexual male with no history of abuse. Patient's family history: his father had hypertension and his mother had no medical history. For medical screenings, he states that his last prostate exam was last year and has never had a colorectal exam. Further review of systems. The patient's constitutional. He had no weight change, no fever, no chills, no night sweats, no fatigue, no malaise. For ENT, no hearing change, no ear pain, no nasal congestion, no sinus pain, no sore throat, no rhinorrhea, and no swallowing difficulties. For the eye systems, patient had no eye pain, no swelling, no redness, no foreign body, no discharge, no vision changes. For cardiovascular, patient has no chest pain, no shortness of breath, no dyspnea on exertion, no orthopnea, no claudication, no edema, no palpitations. For respiratory, patient has no cough, no sputum, no wheezing, no smoke exposure, no dyspnea. For GI, the patient reports no nausea, no vomiting, no diarrhea, no constipation, no pain, no heartburn, no dysphagia, no jaundice. For GU, patient has no dysuria, no urinary frequency, no hematuria, no urinary incontinence, no urgency, no flank pain, no urinary flow changes, and no hesitancy. For musculoskeletal, no arthralgias, no myalgias, no joint swelling, no stiffness, no back pain, no neck pain, no injury history. For skin, the patient does have that 1 lesion to the trunk. Patient notes pruritus to the trunk, no hair change, no breast or skin change on the breast tissue. For neuro, patient has no weakness, no numbness, no paresthesia, no loss of consciousness, no syncope, no dizziness, no headache, no coordination changes, and no recent falls. For the psychiatric review systems, patient has no anxiety, no panic attacks, no depression, no insomnia, no personality changes, no delusions, no ruminations, no SI, HI, AV, or VH, no social issues, no memory changes, no violence, no abuse, and no eating concerns. For lymph, patient has no bruising, no bleeding, no transfusion history, and no lymphedema. For endocrine, patient has no polyuria, no polydipsia, no temperature intolerance. For my physical exam, the patient is alert and oriented. Patient has no acute distress, well developed, well hydrated and nourished. Patient appears stated age. The skin patient does have a lesion present on his right upper quadrant of the abdomen. Skin is warm and dry, appropriate color for ethnicity, nail beds with no cyanosis or clubbing. For the cardiac exam, the patient external chest is normal in appearance without lifts, heaves, or thrills. The PMI is not visible and palpated at the fifth intercostal space and midclavicular line. Heart rate and rhythm are normal. No murmurs, no gallops, no rubs or auscultated S1 and S2 are heard with normal intensity. For respiratory, the chest wall is symmetric without deformity, no signs of trauma. Chest wall is non-tender, no signs of respiratory distress. Lung sounds are clear in all lobes without rales, bronchi, wheezes. Resonance is normal upon percussion of all lung fields. For a neurological exam, patient is awake, alert, and oriented, a person, place, and time with normal speech, normal motor function, muscle strength 5 out of 5 bilaterally, upper and lower, sensation intact bilaterally, reflexes are a +2 bilaterally, cerebellar function is intact, memory is normal, and thought process intact. No gait abnormalities are appreciated when the patient walked in. For psychiatric, patient has appropriate mood and affect. The patient has good judgment and insight. No visual auditory hallucinations, no suicidality or homicidal ideation. For the vitals, the patient's blood pressure is 120/80, heart rate of 80. His pulse oximetry was 99% on room air. His respirations are 16 equal and unlabored. Temperature was 98.4 Fahrenheit orally. The patient is 5'9", weighing 200 pounds or 90 kilograms. His BMI is 29.5 and his current pain rating is 0 out of 10. The two diagnoses the patient presents that they possibly have is the tinea corporis and contact dermatitis. The more likely diagnosis is going to be the tinea corporis, and for that we're going to give a topical terbinafine cream, 1%, apply once daily to affected areas for 4 weeks. The average cost of the medication is $10 for a tube, that's approximately 30 grams. Patient education is going to include the use the medication as prescribed, not to use the medication if they are allergic to it, not to use the medication if they are nursing or pregnant, never take the medication by mouth, and only use on the skin topically, and to wash their hands before and after using the medication. Non-pharmacological treatments that can help with tinea corporis is avoid infected pets and avoid clothing or footwear that doesn't allow for moisture evaporation. My anticipatory guidelines for this patient is colorectal cancer screening, screening for anxiety, screening for depression, counseling for a healthy diet and physical activity for cardiovascular disease prevention, and behavioral counseling for sexually transmitted infections. For follow-up and plan, the patient can follow up in the clinic 4 weeks after this initial visit after the pharmacological treatment for reevaluation of the possible tinea infection. However, some patients do require systemic treatment rather than just local topical treatment for prolonged tinea infections, and if his infection persists after the initial pharmacological treatment for 4 weeks, additional pharmacological adjuncts can be added. And there are my references.